should always touch great importance in our work in disease prevention and control, and we should initiate our emergency plan, and we should use the authorities' speed and also follow the stringent measures with the decisive decisions to race against the virus and implement the measures in details and also curb the spread of the virus. And it should fit in a loophole and also to build a solid and well enough net in order to protect people's health and safety. So that means that we should conduct the epidemiological investigation in order to trace the direct contact and secondary contacts and bring them under quarantine, and also need to learn the travel history in order to expand the tracing size, make sure that no one left behind. For the confirmed cases, buildings, communities, and activity places that should be under control and closed down, and people that under observation should stay at home and also should organize NAT for each district. You also need to implement the tracing and checking in active mode and also bring the people needed in a quarantine place. And also need to put a stringent control on the entry and exit of Beijing in terms of airport, train stations, expressways, and also establish and improve the emergency channel available inside the airport and the train station, and upgrade the risk level of entering to Beijing, and also prevent people from the risk regions coming to Beijing, and stop selling the tickets, train tickets to Beijing. And we should always know clearly the person in charge and who should take the ownership. And also people in Beijing, if not necessary, not encourage people to conduct travel to the medium and high-risk regions. And people in the high-risk regions in Beijing should not allowed leave Beijing. And we also need to guarantee that the good guarantee of the market order as well as the society order, and also should ask everyone to practice the COVID-19 containment methods and protect yourself well, and conduct few gatherings, wear masks, keep your hand hygiene, conduct frequent ventilation, keep social distancing, and also practice your obligations and responsibility. And also not unnecessary, do not leave Beijing. If you have travel history regarding risky areas, or you have the contacts the people from the risky areas, please report to your local community or to the hotels. So let's work together to keep Beijing safe. Today we invite the people, officials from the Chaoyang district, Mentogo district, and also from local CDCs as well as the health commissions, and also the COVID-19 prevention and control leading groups. So they are Ji Jingli from the COVID-19 prevention control working group in Beijing, Wen Tianwu from Market Law Enforcement Department, Zhu Sheng from Chaoyang district, Qing Zhaokun from Mentogo district, and Madam Pang Xinhuo from a local CDC. First, I give the floor to Madam Pang Xinhuo to elaborate on the newly confirmed cases and also the risk level upgrading, and also give you the suggestions on COVID-19 containment. Friends from the media, good afternoon. Now I'll give you the updated information regarding the newly added 3 imported related cases in Beijing. From 0 to 12 o'clock on 4th of August, Beijing had 3 imported related locally transmitted COVID-19 cases. They actually are all the close contacts of confirmed cases on the 1st of August. And 2 are the confirmed cases relatives, and they had a travel history to Hunan Zhangjiajie. And another one is the close contacts with the confirmed cases on the same plane. And for case 1, lived in Fangshan district. The relative of the confirmed cases released on August 1st. And with the families, paid a visit to Hunan province and came back and went to Hainan on 28th of July and took CZ8804 from Sanya Airport to Beijing Daxing Airport on 30th of July. On July 31st, the community identified a person need to stay at home for further quarantine because of the travel history to Hunan. And on August 1st, also brought to decentralized quarantine with negative to COVID. On the 3rd of August, another round of NAT and positive to COVID. And right now, transferred to the designated hospital based on the epidemiological investigation, lab results, image testing, and clinical manifestation, and is the confirmed cases on the August 4th. And moderate case. Case 2 lived in Fangshan district. Also, the relative of the confirmed cases on August 1st. And the travel history, same as the case 1. And as the July 31st, the case 2 actually is identified as the person with the travel history to Hunan and the negative to COVID. On August 1st, also brought to decentralized quarantine place with negative to COVID. On August 3rd, another NAT test, and the result is positive, and also treated at the designated hospital based on the epidemiological investigation, the clinical symptoms, the lab testing, and the person today identified as the mild case of COVID-19. Case 3 lived in Wangjing Guofang Shangguan of Chaoyang district, and the person took CZ8804 from Sanya Airport to Beijing Daxing Airport on July 30th. Basically, this person took the same flight as the previous case and paid a visit to Wangjing Street and also required to stay at home for further medical observation on August 1st and August 2nd, also brought to decentralized place for quarantine and with a negative result of COVID. On August 3rd, another round of NAT showed a positive result of COVID-19 and treated at the designated hospital based on the epidemiological investigation, the lab testing, image testing, and the clinical symptoms. On August 4th, the person identified as the moderate case of COVID-19. Right now, the above-mentioned cases, we have conducted the epidemiological investigation, gene sequencing, and treated in the hospital, and we also trace 50 close contacts. And for the relevant secondary contacts, right now is under checking. And according to the Beijing CDC, the result of gene sequencing shows that it shows highly identical to the gene sequencing in Nanjing, because the strong contagious of the Delta variants, and also very strong in transmissibility. Once again, I call everyone, if you had the travel history to the medium or high risky regions, or you had a contact with people with travel history to these risky areas, please report to your local community or to hotels, and please cooperate with relevant COVID-19 containment measures. In recent days, we saw the sporadic cases happened in different cities and provinces, and also situation in Beijing is critical, and we face increasing pressures on preventing imported cases. For each department, we should implement the responsibilities, and also we should do everything we can to practice the COVID-19 measures in order to prevent imported cases from spreading further, and also the virus spread that we've seen in Beijing. And for the people living in the same community or working at the same company as the confirmed cases, and they're not allowed to leave Beijing. And if you have to go to other provinces, please always pay attention to your destination's COVID-19 practice. If you finish your travel, come back to Beijing, please report to your community, your villages, and also please monitor your own health condition and cooperate with the COVID-19 practice in Beijing. And for the public areas, the body temperature should be measured, and information should be registered, traffic should be controlled, and also people should keep social distancing, and also all these places should conduct regular ventilations. Right now in summer days, it's really hot outside, but please wear your masks and conduct a few public gatherings, and also please not stay long in the indoor places, and always keep your hand hygiene and monitor your health condition. If you show symptoms such as fever or coughing, please wear masks, and also go to the nearby fever clinics for further treatment. And this is the updated information. Regarding the upgrading risk levels, in recent days we have found that the Delta variant field cases happened in Beijing and other provinces, and also found the infected cases because it's high transmissibility and the more contagious than before. Longzeyuan, Longyeyuan second community, and Lehejiayuan identified as middle risky levels. So far, we have 2 middle risk regions, and the other places in Beijing are still low places. Thank you. Thank you, Madam Pang Xinhuo. Now I give the floor to Zhu Sheng from Chaoyang District to give you updated information regarding COVID-19 measures. Friends from the media, good afternoon. For the confirmed cases in Guofeng Shangguan community, Chaoyang District initiated emergency plan conducting the relevant works. Let me give you a brief introduction. First, we swiftly traced close contacts. The confirmed cases, the close contacts of the previous confirmed cases, and in the centralized quarantine places from August 1st. And also we trace the 4 close contacts, and right now they stay at home for further quarantine. For the 3 close contacts, right now is under the district centralized quarantine places. Their swab test were collected and negative to COVID. Second, regarding the epidemiological investigation, based on our preliminary studies, we traced 50 close contacts. Right now, they are transferring to the quarantine places. Third, regarding the community of confirmed cases, the relevant streets right now under lockdown. When we received the report of confirmed cases, a local initiated the emergency case for Guofeng Shangguan community and Lianluo building, Fengheng Shidai. We're now all under lockdown and also release this information to the public, and the residents in these areas should stay at home and also work with Jinkelong, the supermarket, to deliver the necessities to the residents under lockdown. For the public areas, Botai Guoji Business Street and Wangjing buildings, Boshi Xiangyuan community also under lockdown. Fourth, we also started to conduct the samples for NAT and also collect samples from the environment. For the lockdown areas, right now the NAT work is going on as of 3,396 samples collected and 340 samples from the environment was collected. Going forward, we will implement the guidance given by General Secretary Xi and also the unified arrangement made by the municipal government, and we will intensify our efforts to prevent the imported cases for further spreading, and we will also stay alert and keep vigilant to our work, and also put a close eye on the epidemiological investigation progress, and also conduct environmental disinfection and cleaning. And for parks, sightseeing places, supermarkets, shopping malls, restaurants, farmers market, hotels, that a mask is required, and also people should keep social distancing. For airports and other highly condensed places, that's also our key focus. If we find any loophole, we ask people to correct ODs. And for the community level, we also practice the more stringent measures. And for logistics, for the cold chain, taxes, housekeeping people, and we will conduct more frequent NAT and also check the COVID-19 practice. For the quarantine places, we also intensify our efforts to have enough supplies. And last not but least, I thank you for your long-term support and care of our work, and also call for everyone for your further cooperation. For the 31st of July, if you paid a visit to the relevant places, and to please make a phone call to report your history. For the people in Wangjing district, not allowed to leave Beijing. If you have to go, you need to have a green code and also a valid 48-hour NAT results. Thank you. Give the floor to Mr. Qi Jingli from the COVID-19 Prevention and Control Working Group in Beijing. Give you the updated measures taken at the public areas. Friends from the media, good afternoon. Right now we're in a critical moment because we are facing a revisit of the virus. So it's very important for us to curb the further spread of the virus. The working group also redoubled our efforts to conduct the supervision work, and also the media help us to conduct a monitoring work. And we have seen that the cases reported by the media outlets regarding the loopholes in COVID-19 prevention in the supermarket theaters. We have seen that not a stringent practice in the key areas such as theaters or supermarkets, so temperature not been taken, or the green code or the code not scanned. In Haidian, we found that the cases or the phenomenon that people not scan the code and also people not really check the code. At Zhongguancun, we also found the same situation there. So people neglect of duties, not check people's temperature or their health code, although all facilities actually are there. Or in a certain a grocery store, we haven't found any COVID-19 practice facilities. And also inside the stores, we found that there's no people really monitoring the whole practice. So for the public gathering places, we found that this is a practice actually found also in the Beijing district. And even for the movie theaters, the people's temperature not taken and the code not scanned. The same case also happened in Pinggu district, Daxing district. We have also found that the people not cooperate. Second, regarding the social distancing. So we have the labels on the ground marking the 1 meter social distance. But people ignore that, and also the staff also not give the notice to the people or correct their behavior. Third, regarding masks in IKEA, we found that the customers not wear masks or they not really masks in a correct manner. We also found that people gathered and chatting, but without masks. So at the dining places, although the staff was there to ask people to wear their mask back after the finishing their dining, but still we found people not do so. We found even some store staffs not wear masks. In the barbecue store, we found that staffs not wear masks in the correct manner. Tongzhou Pinggu Miyun, we also found the same behavior. Fourth, regarding the practitioners in cold chain logistics. In Fengtai district, in the cold chain areas, some staffs actually not included in the NAT testing scale. Or that the staff not receive their NAT in a timely manner. So these actually are all the loopholes we found in the day-to-day practice of COVID-19 containment measures. And we have asked the relevant people to correct all these behaviors. There's no solution I can correct all these overnight. So we ask all the relevant departments and stakeholders should strictly follow and implement the COVID-19 measures. And to shoot the hidden risks. And also welcome the media as the whistleblower, help us find all these cases so we can work together to shoot the potential problems. Any tiny wrong behaviors may cause a huge impact or heavy toll to the society. So we talk about wearing masks is the most effective way. We know in the summertime it's not really convenient or comfortable to wear masks, but still mask is the most effective way to curb the spread of the virus and keep you safe. And also we talk about the fewer parties, gatherings, and also please keep social distancing always. And third, vaccination is not means that you are undefeatable. So you should always protect yourself well by wearing masks, keep your hand hygiene, and keeping social distancing. Thank you. Thank you very much, Qi Jinli. Now give the floor to Wen Tianwu from Law Enforcement Market to brief us the supervision work in the office buildings and the shopping malls. And in recent days, we found the newly confirmed cases emerged in Beijing. A law enforcement department dispatched the additional teams to conduct the supervision work. On the basis of a regular check, we have conducted a monitoring work in the office buildings, the shopping malls, supermarkets. So let me give you the information. From the 29th of July, we took the swift speed with the most stringent actions to conduct our work. From the 29th of July to the 5th of August, we have finished a new round of checking in these key areas. First, we continue to educate the COVID-19 measures to the key areas, and second, we focus on the key practice. For example, the body temperature should be measured, and people should wear masks, and social distancing should be followed. Third, regarding the problems we found during the checking, and we ask the stake owners to correct their behavior. And also, if they not correct their wrong behavior, and we should release their information to the public. From 29th of July till today, we have checked 12,000 places, 1,039 cases of wrong behaviors were found, and 124 companies were required to change their wrong behaviors. Law enforcement supervision is our regular checking. So far, 483,000 companies and places have been checked, and the 18,000 cases were investigated. And more than 8,000 companies actually required to change their wrong behavior. Regarding the key issues we found, first, we found like they lowered their guard by relaxing the COVID-19 practice. For restaurants, we found the emergency problems, and then is the supermarket and office buildings and the dining places. Some companies not check people's temperature and their health code. And second, is staff not wear masks. Third, and the third, the companies do not have the systems to collect the staff's health information. And fourth, we found that some companies do not have the cleaning record. So 80% of the wrong behaviors we found during our checking or supervision are the above mentioned phenomena. So this is actually the hidden risks for the potential resurgence of COVID-19. Haidian district, we found Yan Binghao foreign trader, and they not take the incomers body temperature. And in Shunyi district, Guotai Dongfeng Company, Longhua shopping mall, we found that their staff not wear masks in a correct manner, or they not ask the consumers to wear masks in correct manner. Guanming Dining Company, Huilongguan District also found this kind of situation. In Miyun District, Lixiangyuan Restaurants and the Jingyanlou Company also found that their staff not wear masks in a correct manner. And we asked all these shareholders to correct their behavior. Going forward, because of a variant with a fast transmissibility and more contagious, we also need to race against the virus. So that is why I also ask us to intensify our efforts in the supervision work in the key areas and to check the wrong behaviors and shoot the hidden risks and conduct the targeted checking work in order to see that all the COVID-19 measures implemented in a stringent manner. So we ask the companies or these relevant stakeholders have a detailed working plan to practice COVID-19 measures. And also we talk about the masks wearing, social distancing, the ventilation, and the hygiene. All these COVID-19 measures should have a designated person to check whether people cooperate and practice all these or not. So regarding all the wrongdoings, we ask the relevant departments to correct. And we also urge the relevant departments to make their correction. We should never lower our guard against COVID-19, and we should earnestly practice COVID-19 measures and practice and implement our responsibilities in order to curb the spread of the virus and keep people safe and health. Thank you. I give the floor to Madame Qing Zhaosheng from Mentogo District. Friends from the media, good afternoon. Since the outbreak of COVID-19, Mentogo District earnestly implement the General Secretary Xi's guidance because this is a people's war, and we also implement and worked on the plan made by the municipal government. And we always follow the stringent and high standards in implementing our work in order to build a firm and strong wall against COVID-19 virus. We have never seen the newly reported cases in the past 441 days. First, in face of a critical time amid COVID-19 outbreak, we organized meetings and initiated emergency plans in order to prevent resurgence of COVID-19. For the close contacts, the secondary contacts, and the person found by big data, we locked to the individual and also check their NAT. We also have the standardized stringent management of the centralized quarantine places, and we also have the lockdown hotels in addition. So we have enough places to quarantine the close contacts. And third, we also intensify our efforts in the COVID-19 management in rural areas, and all the practice should be implemented. And if people need to stay at home, we make sure that no one get out. And for the vaccination, we are the first to give the jab to the adolescents aging from 12 to 17 years old. So far, for the adult vaccination rate reached 92%. For adolescents from 12 to 17 years old, a rate reached 80%. Regarding the nosocomial management, the people need to book appointments before they visit to the hospital, and we also have the epidemiological inquiry before they're receiving the hospital service. And for all the medical personnel, they received NAT in every 3 days in order to prevent cross-infection inside the hospital. Fifth, we also improve the NAT capabilities. So far, we have 48 stations for NAT purpose, and also seamlessly cooperate with the relevant testing agencies. So make sure that we can finish city-wide NAT within 3 days. Regarding public area management, hotels, the supermarkets, shopping malls, toilets, the corridors, the elevators, the chairs, the garbage stations, we intensified our disinfection efforts. And for the office buildings, restaurants, we also check more frequently regarding the COVID-19 practice. Regarding the A, B, and B places, we also ask the market entities to earnestly implement and practice COVID-19 measures. And regarding cold chain logistics, we had the tracing system available, and also for the practitioners in the COVID-19 in people, so that they should receive NAT and also should protect themselves well. And also we use the online and offline platforms to repost the authorized information, our official account, and also ask people to practice regular-based COVID-19 prevention control measures. And second, follow the arrangement made by the central and local government. We keep a close eye on the dynamic change of COVID-19 home and abroad. So in order to build a safe wall to prevent the further spread of imported cases. From January 20 last year, we established a working group and 13 sub-working groups. And based on the changes of COVID-19 situation, we had 20 groups to deal with COVID-19. So we have the emergency plan available, and also we have the NAT plans. And for key groups, key industry, key regions, key place, key personnel, we all have the plan. Second, we have accumulated rich experience, which means that once we found the confirmed cases, we immediately locked down the places and also conducted the disinfections right away, and also conduct the NAT as well as the epidemiological investigation, transfer the close contacts to quarantine places, and also have the COVID-19 the brochure. Right now is coming to the 2.0 brochure. So this is the scientific approach we have adopted. And third, regarding ventilation, the vaccination process. So in our district, we have a lot of motorized places. In 13 streets, we established 16 temporary vaccination stations. So make sure that the arrangement of the vaccination booths is distributed in a balanced manner. And also we have seen that the party and the party members always take a leading position. Fifth, we talk about this is a people's war, so we rely on the people's efforts and also have a team of volunteers. And we also have a detailed action plan based on the 3-year working plan, and also ask people to participate in the patriotic campaign. Third, we should do everything we can to keep our people safe and healthy. Right now, in face of the critical challenges and also the upcoming Winter Olympics, Wintogo District always earnestly implement the plans made by central and local government. We always follow and keep our actions with the most stringent requirements, and also we focus on the controls and also our management in hospitals, in schools. Make sure and each milestone and doorsteps are well kept and controlled by us. Thank you. Thank you all the speakers, and thank you friends from the media, and thank you all the working staff, and this is the end of today's press conference.